Welcome to a Prevent Connect podcast, where we explore the prevention of violence against women. This is a project of the California Coalition Against Sexual Assault.
My name is Andrew Levack, and I work with EngenderHealth. Some of the work that I'm doing right now is adapting some evidence-based interventions that have been carried out in other parts of the world: Brazil, India, Ethiopia, South Africa. And these are interventions that look at issues of masculinity and constructions of gender, both for men and women, and sort of the messages that young men and women get about being male and female, and seeing that as a key determinant to a range of health outcomes, not only issues of teen pregnancy and HIV, but also issues of violence, issues of family engagement and fatherhood involvement, and really taking a look at these interventions that have been carried out in other parts of the world and saying, you know, why isn't this work being done in the U.S., and can we find some opportunities to integrate this, in some cases in school settings and in some cases in other community-based intervention settings. There's a well-known program in Brazil that's carried out by Instituto Promundo. It's a local NGO that's based in Rio de Janeiro, and they have a program called Program H, which H stands for homens in Portuguese, or hombres in Spanish, a project with men. And the program is an educational intervention that works with young men, usually men aged 15 to 24, and it works on providing multiple types of interventions with young men and gives them an opportunity to build their awareness around social constructions of masculinity and male gender norms, question some of those constructions, and sort of redefine for themselves what it means to be a man. And in redefining that, really take a look at how more positive notions of masculinity as defined by them can improve their lives, can sort of address a range of health outcomes, but also improve their lives and better relationships with them and their partners. There have been several outcome evaluations carried out. The main researcher has been Julie Poolerwitz. She's associated with PATH, and they've done 3 different evaluations of Program H. One in Brazil, the first one in Brazil, and a quasi-experimental study that looked at basically 3 different intervention arms. One was the Program H educational workshops by themselves. One was the Program H educational workshops along with a community-based activity, a campaign around gender equality, and then a third delayed intervention. And what they found from that initial study was that young men who participated in the program were more likely to hold more equitable gender norms, and that they are also more likely to use a condom during sex, less likely to report use of violence against a partner, and less likely to report STI symptoms after both a 6-month period and a year follow-up. And what's interesting is that the protective effects of the intervention were found to be even more significant after the year. So some pretty compelling evidence that addressing these underlying constructions of masculinity are important, and that, in addition to that we can measure these changes in gender norms, and that they can influence more than one particular health outcome, that we can take a look at HIV and issues of gender-based violence, and that one intervention looking at this underlying determinant of gender is a pretty important issue to take a look in influencing multiple health outcomes. I mean, it's interesting because this work has been adapted in many different settings, right? My work with Promundo and my work with EngenderHealth has adapted this work in South Africa and Ethiopia and Nepal and in places including Bolivia. So to adapt it in the United States, you kind of follow those same fundamental principles, which is to take a look at the educational interventions, think about the context of the U.S., and then basically field test them and give some opportunities to tweak it as needed. But what's so interesting is that these educational interventions, while there's some adaptation, there's a lot that you don't have to adapt, because they're participatory activities that allow young men an opportunity to simply reflect on their own reality about what it means to be a man and what the messages are that are being a man. So in some ways, by being a participatory natured group educational workshop, the adaptation is just the different group that has an opportunity to reflect on these issues. Throughout all the adaptations, I think that in the educational workshops that are carried out, one of the core issues is that the issue starts with gender. It starts with an opportunity for young men, and sometimes young men and women, to take a hard look at what are some of the messages that they've received in their environment about what it means to be male and what it means to be female, and how some rigid notions of those definitions is really a setup for men and women around engaging in high-risk sexual activity or using violence and domination over women in order to achieve their ends, and sort of also these messages about what it means to be a man in terms of their engagement with their family and in their role in healthy relationships. So it starts with that, and then sort of building on that gender analysis, then there's an opportunity to really reflect on different particular health issues that are really relevant. So one of the adaptations in the United States is that there's a little bit more focus on teen pregnancy prevention, since that is such a relevant issue here in the United States. But the same rigid notions of masculinity that might drive the HIV epidemic in South Africa are also some of the same issues that are impacting teen pregnancy here. Gender, it's really seen as this gateway factor, right? This core issue that has such an influence on a range of issues. And so if teen pregnancy is the issue that you want to do, certainly, gender norms play a role in that, but gender norms also play a role in issues of sexual violence prevention, dating violence prevention. And so I think what we have to understand is that in any prevention program that you're doing, in whatever your health outcome is that you want to address, we've got to take a look at the messages about what it means to be male and female, and how that gender analysis needs to be involved in all programs. And beyond that, I think that we can't think about these issues as these isolated outcomes that we have to only address, right? That we can't look at the silos of public health, of teenage pregnancy and STIs and gender-based violence, because people's lives don't operate in that reality, right? If you work with a young adolescent, they might be dealing with relationship issues and issues of sexual decision making and issues of power in the relationship, and these gender norms are influencing all of that. So we'd like to see a better gender analysis with all the prevention work, and I think by doing that, this is one key determinant to influence a range of adolescent health and public health outcomes.
Thank you for listening to this Prevent Connect podcast. Prevent Connect is a project of the California Coalition Against Sexual Assault, with funding from the Centers for Disease Control and Prevention. The views presented on Prevent Connect are not necessarily the views of the United States government, the CDC, or CalCASA. To learn more about Prevent Connect, visit www.preventconnect.org. For more information about CalCASA's mission or to show your support, visit calcasa.org. That's calcasa.org.